that.
It's okay. As you rightly said just now, the eye is the king of the body, and we know that the eye is the light of the body.
That's right.
And the eye is actually the light of the world. And it is what makes us to be cheerful and to reduce anxiety and depressions. You know, when the eye sees an object, that is the one that will take signal to the brain to interpret the beauty of life.
Yes, I know that. The beauty is in the eyes of the beholder.
Yes.
We use the eyes to see virtually everything.
Of course.
Let's discuss the importance of the eyes. How strategic is this? Why do you refer to eyes as the king of the body? Ujuni Babara. How important can we do without our eyes?
How? I wouldn't say no. But to deal with life and to behold the beauty of life, the eye is very essential and very important. It's the eye that we perceive an object, perceive an image, that will now send it to the brain to interpret that we are looking at this. This is what you are seeing. This is the path to go. This is the way to go. And this is what you should do. It's very, very important as part of the sense organs.
So if it's that very strategic and very important, and our life revolves around it, what can we do to nurture our eyes? What kind of food should we take to nurture our eyes? And what are the things to avoid so that we can preserve the health of our eyes?
Okay. We have a saying in ophthalmology that good vision is good life.
Good vision, is good life. I like
good
that.
Vision is good life. So be able to preserve our eyes. There are some things that we have to do to ensure, to give us the opportunity to have a good vision so that we'll be able to live a good life. Starting from let's start from what we avoid first.
Okay.
If we want to maintain good vision and still enjoy our vision maximally, we should stay away from some things like alcohol, like some other harmful drugs, the use of topical antibiotics unprescribed, the use of traditional herbal medications that some people applied into the eye. We should avoid it. The use of some, let's say, some commodities at home to
like
treat,
what?
For example, use of onions, use of camphor.
Use of onions?
Yes. Some people put
what do you garnish your efori roll with?
No,
onion
use of onion to apply to the eye directly.
The eyes. Oh, you scared me.
Yes, no. Don't apply it directly to the
eyes. Okay.
Use of menthols. When some people are having ocular allergy, that will tip them to itching of the eye. They use a lot of sort of things like onions, battery water. When they're having redness, they perceive that they're having Apollo. They use battery water. The use of urine to wash the eye. The use of breast milk, especially by mothers, young mothers.
They do that?
Yes, they apply breast milk when their children are having discharge from the eye.
Okay.
So all those things can lead to blindness.
Blindness.
So we should avoid things that can lead to blindness.
Okay.
So that we can have good vision.
Okay.
So you mentioned that what are the things that we can be eating
That's right.
to maintain good vision.
Yeah.
To maintain good vision, you need a lot of fruits.
Okay.
You need balanced diet. Apart from the balanced diet, you need fruits. A lot of fruits like carrots, like watermelon, like cucumber, all these fruits, orange. We need fruits in good concentration for us to have good vision. Yeah. And we need vegetables. That is where we get folic acid and some other items like zeaxanthin, calcium, and all those things that will help us to maintain good vision.
I don't know whether my biology lessons or biology knowledge still serves me right, but I remember vividly that the eyeball is like a football, it's like a ball in the socket in there.
Yes.
It has some layers and parts. Can you break it down for us so that we have a fair knowledge of what we have in our eyes?
Actually, we have the globe. Okay. So when we divide the globe, we
call it a globe.
We call it globe.
Like the word globe.
Yes.
That's right.
The eye is like a globe. Okay. So we use it to perceive the universe. So the anterior 1/6 of the eye, call it cornea. And the posterior 5/6, we call it the sclera. The cornea, the angle between the cornea and the sclera divides the eye into the anterior segment and the posterior segment. So the layers of the eye now, if I want to start from the cornea, we have the cornea, we have the iris, which embedded the pupil, we have the lens. Then in the lens, we have the anterior capsule, we have the posterior capsule, we have the less substance in between. The posterior capsule, now, from there, we get to the posterior segment of the eye.
Okay.
From the posterior capsule to the retina, that is what we call the posterior segment of the eye. And in that, in the anterior segment of the eye, is filled with aqueous, while the posterior segment of the eye is filled with the vitreous. So if there is any problem between the anterior segment and the anterior posterior lens capsule, it can block the vision and tip the patient to blindness. If there is some problem directly on the posterior segment involving the retina pigment epithelium, the optic nerve, and things like that, the macula itself can also lead to blindness.
But the outer part is what we call the lens, right?
It's
from a layman's language.
Cornea.
The cornea.
The outer part that you are looking at.
Where is the lens?
The lens is at the back of this cornea.
At the back. Okay, it's the cornea that supplies the lens, right?
No.
That sends message to the lens, I guess.
If the cornea is clear, the cornea itself is a transparent part of the eye. It's embedded with collagen and water. So it is transparent. If there is any opacification on the cornea, it will prevent light images from transmitting through the lens onto the macula, from where electrical the rods and cones and the photoreceptor cells of the posterior segment, we send electrical signals through the optic nerve into the brain to interpret that particular object.
Now, everybody loves to look beautiful with sunglasses, with glasses like that. You look beautiful in your own.
Thank you, sir.
But experts do say that if it's not recommended, it's not advisable.
Yes.
What do you say about that?
If an individual is using an unrecommended spectacle, for example, you just pick your uncle's spectacle that is having lens embedded in it, and you yourself, you are
recommended lens.
Recommended lens. You pick an uncle's recommended lens. You yourself, you are not having any refractive error. You started using it. Actually, if that patient is having, for example, is having hyperopia, which the person needs to use glasses so that the patient will be able to see the distant object clearly. By the time you are using it, the power there will bring all objects very close to you. And by doing so, you are affecting your brain, because the eye attaches straight to the brain. So you're affecting your brain. Your brain will now be interpreting those objects as blur, because it's forming far, far behind your retina.
So it's not advisable. It's
not advisable.
What of sunglasses?
But you can, yes, sunglasses is good because of ultraviolet radiations that can even affect the eye.
It doesn't cause any injury to the eyes?
No, no.
Not injurious at all?
It's not injurious. You are using sunshades. It does block ultraviolet rays from entering your eye. It will also prevent you from developing pterygium.
Then you said it earlier on that there are certain things that we do, like consumption of alcohol and some other things like that. It's like a smoker. If you buy a packet of cigarettes, it is written right there, smokers are liable to die young. Despite what you are saying, some people still love to consume alcohol. So if you consume alcohol, despite warnings from experts like you, how can you protect yourself and your eyes from getting damaged by virtue of your habits? Let me use that word.
Well, we are talking about habits that they find it difficult to change. You find it,
and they still want to have their eyes. Eating your cake and have it.
Actually, the white man saying that you can't eat your cake and still have it. But you can still prevent the effect of those alcoholic drinks by reducing the concentration. For example, if you take...
Or the frequency.
The concentration, not even the frequency alone. If peradventure you take a bottle of beer every day, and you take 10 bottles every 5 days. So you know the person that takes 10 bottles every 5 days. He's even having more concentration than person that takes
a bottle a day. Okay.
So for people that find it very difficult to stay off alcohol completely, they should increase the use of ocular antioxidants.
Okay.
We have different ones. I'm not marketing anybody. Ocular antioxidants, and increase vegetable and fruits intake.
Okay.
And increase fluid intake, which is
fluid
water.
Intake.
Liberal water intake.
Okay.
As you are taking, you are diluting it.
I hope some of my directors, like Baba, they are listening to you. But I want to ask you this again. Is eye issue hereditary? But for instance, in my own lineage, my father used glasses to read. My brothers, my sisters, but I've resisted it. No, I can see clearly, and I have this conviction. I may not need it. They will make jest of me that I'm just buying the time. Is it hereditary for you to be predisposed to eye challenges? Had I been short-sighted or some stuff like that?
Yes, it is hereditary.
Okay.
It is hereditary, especially the myopics. We actually do advise that patients with very high myopia, they should avoid a spouse, marrying a spouse with very high myopia.
So it's a marriage counseling tip?
It's part of marriage counseling.
Wow.
If you are having maybe myopia of about -14, I would advise you to go and marry a woman with myopia of like -8, -6, -10.
People don't pay attention to that. Do you know that?
Most of the time, they don't pay attention to it. But most of the time, we don't normally see them coexisting like that. Okay. But we do still say that when you have very high myopia, you don't marry an individual with very high myopia. Okay. We have a lot of congenital eye issues. Glaucoma is congenital, can be hereditary. So if you have a relative, or maybe your father is having glaucoma, your mother is having glaucoma, you have higher chances of developing glaucoma as you grow. In fact, they can even give birth to an individual or a baby with congenital or developmental glaucoma. So we have a lot of hereditary eye diseases.
That brings me to the issue of glaucoma. I mean, you do have World Glaucoma Day. Madam was here sometime,
yes.
Professor. She was here sometime and she spoke about it. How prevalent is that in Nigeria?
Yes, the prevalence, we have some prevalence studies. The prevalence we got from Kwara State in 2015, we were able to have about, in the urban area, they have up to 18%, while in the rural area, they have like between 12 and 14. In Osun State, in 2018-19, I did a study where I got 24% in the urban and 18.6 in the rural area in Osun State.
Okay. You have more glaucoma in the urban than in the rural areas. What are they doing right in the rural areas that we are not doing right in the urban centers?
Actually, in the rural area, they have access to fresh fruits and
vegetables.
Lot of fruits, vegetables, fresh.
Okay.
The ones they get in the urban may not be like that. But more, and the point that I can derive from that is that there is rural-urban migration. We have more people in the urban than in the rural area. Yeah, so that will account for the differences. Okay.
Now, between glaucoma, river blindness is one of the things you guys take care of. Am I right?
Yes.
Is it prevalent here?
Yes, onchocerciasis, the prevalence is going down. We just have about 3% in Nigeria.
In the entire nation? Okay. Vaccination?
Not vaccination per se, but with the advent of ivermectin, there are some people call Mectizan, that they are giving
kids
in the rural, not these kids alone.
Okay.
In fact, they give adults.
Okay.
But some children, the dose can be adjusted. They normally take it at the local government headquarters in the states, or the local government. So that is what is used to kill the adults.
Oh, that was what we all took during COVID-19, right?
No, yes, eventually they said it's work.
That's right. I remember I got a bottle from a friend of mine from the local government. Wow. That's right. I'm making a confession on air.
Of course. So Ivermectin is the one that is used to prevent the blindness that should result from onchocerciasis. So in fact, we still have some onchocerciasis patients.
So we have a reduction in that in Nigeria now, 3%.
Generally.
That's scary news.
Yeah.
Yes, madam, most often than not, laymen like us can't differentiate between an ophthalmologist and an optician. People we walk up to on the street, everybody present themselves as professionals that could diagnose our eye ailment. Can you distinguish and differentiate for us?
Okay, we actually have three arms.
Okay.
We have the ophthalmologist, we have the optometrist, the middle,
I forgot that.
then we have the optician.
Okay.
An ophthalmologist is a medical doctor that has completed medical training of 6 years, plus or minus.
Before becoming a consultant.
Yes. So, no, 6 years of medical.
I know, before you go to residency.
So before you now start residency in ophthalmology and spend 6 to 7 years and become a consultant ophthalmologist.
Wow.
As a consultant ophthalmologist, yes, it's a great journey. As a consultant ophthalmologist, you are licensed to treat medical, optical, and surgical.
Medical, optical, and surgical
aspect of the eye.
Aspect of the eyes. Okay.
Yeah. Why the optometrists? Their major work is to treat the optical. Though they can still manage some little medical, like red eye, allergies, things like that. But when we are talking about glaucoma, when we are talking about diabetic retinopathy, hypertensive retinopathy, optic neuropathy, things like that, it's meant for the doctors that are optometrists. The optician now, they are to just cut the lenses that has been prescribed by the optometrist.
They're like pharmacists, or they are just like people that dispensers?
They are dispensers.
Are you aware there's a confusion out there that people with eye challenges, they go to opticians? Are you aware of that?
Yes, we are aware.
So what are you doing about that so that people don't go, they don't go to an optician with a lesser ailment and they return with bigger problems? Yes,
most of the time they will have changed some patients with glaucoma, for example, will have changed their spectacles severally. Some patients with anterior uveitis, they will have been given treatment for red eye for so long before they present. Actually, there is nothing much that we can do concerning that, other than things like this, awareness programs.
And that's what that brings me to the issue of advocacy. Because if indeed Ojuni Babara, and you know that we have to preserve the sanctity of our eyes, our vision is key and is very important. What advocacy do you professionals do to assist people out there so that they can access real professionals and Medicare when it comes to eyes?
Advocacies like this, awareness programs, outreaches, like the one that we are doing presently in the state now, this OMOLOLA medical mission.
That's right.
We did one the other time. Ophthalmology was able to see 9,133 patients, eye patients. We were able to see them because we still have a lot.
9,000?
At the first one. The one that we are doing now at Elisha, we saw about 3,000 plus. The one we did last week.
Just one outreach. And you have about, I think, 6 to go.
And we are able then to do 705 surgeries, cataract surgeries, and pterygium.
Now, tell me about the,
So what we do is to, now, every one of us that are going for this OMOLOLA medical mission, we are majorly specialists that are handling the patients. But, you know, in medical practice, they don't allow specialists to advertise. But in the circular world, they allow the non-specialists, even the non-medics, to start advertising. Come and come and treat your eye. Stand 1, stand 2, stand 6. So
those are the
problems that we can.
You should be able to resist that. But if you professionals who are trained and you have gone through training, medical school 6 years, residency another 4, 5, 6 years,
7,
8, and you can advertise, and people who are not even skilled can advertise, that is contradictory. It's a contravention.
Yes, that is enemy in Nigerian Medical Association's rule. Maybe in future
they can relax the rules for you. The profession is very conservative, I want to say, not as vibrant and as liberal as ours.
In medicine, we believe that your work will speak for you.
Wow.
The patient comes to me now, I treat the person, and the patient is very good.
So you get your client through referral?
Through reference.
Oh, okay.
But people that are not specialized, they want to make noise.
Because the empty barrel.
Make the
loudest. I agree with you. Then I want you to tell me, at what age does a man need to start to pay attention to vision impairment or changes in your vision, or to be conscious of the need to visit you?
It's okay from age 40.
40? From
40. Because from 40, you start, even if you have the best vision, if you are seeing 6'4", you have the best vision, by 40, your something that we call presbyopia normally sets in. So your ability to read near vision will start reducing because you will have exercised a lot of your accommodative reserve. So you want to improve it with glasses or contact lens or surgery, the advanced world. So you will have to come. By then, if you are reading, you are not seeing clearly, you will still want to see an ophthalmologist or see someone for eye. And also from 40 years of age, glaucoma, especially in the black, sets in at that age. So from age 40. So we have a lot of eye diseases of the children, developmental glaucoma, cataract, congenital glaucoma, things like that.
Now, contact lens is very fashionable.
Yes.
And how advisable it is. Let me tell you this. I traveled once and I saw my daughter and I saw her eyes was looking like a cat. So I was like, what are you wearing? And she told me, Dad, I'm wearing a contact lens. And I know she needs to put them in some store overnight or something like that. It's a bit cumbersome for me. Yes. Do you think that contact lens is better than a steel lens like this?
Well, I would say it's not better because in some areas, for example, we want to talk about someone that usually swims. It's not good for you to be using contact lens because we have one organism that we call acanthamoeba. If they affect the eye, they are just going to destroy the cornea. And all these fungal infections is patients that are using contact lens, they are usually prone to them. And contact lens is not advisable as day-to-day wear because we have extended wear that you can wear up to 24 hours, but you still have to remove it for the cornea to receive atmospheric oxygen. So it's not really advisable for someone to just be on contact lens
throughout
for a long period of years. The patient will still develop some corneal problems.
Because it's beautiful, people.
Yes, it's beautiful. It can change the color of your eye. You can use red, blue, green, any color that you wish.
Thank you so very much. We are good on the break. I'm not letting you off the hook yet.
It's okay.
Viewers at home, my guest has been Dr. BOLA OMOLOLA, consultant ophthalmologist at Osun State
Specialist
Hospital, Ashubiaro. We'll be back after this break. Don't go anywhere. The topic is your eyes.
Born Jeremiah Oyeni Obafemi on March 6, 1905, Obafemi Awolowo was a prime architect of Nigeria's independence and most consummate advocate of free education and social welfare in Africa's most populous nation. Erudite politician, thinker and philosopher, Awo was fondly addressed by associates and political colleagues, brought his unique attributes to bear on governance in the defunct Western region. He administered as leader of government business and the premier between 1955 and 1958. Obafemi Awolowo's premiership witnessed pioneering in multi-sectoral policy initiatives and execution. The Western region under his administration paraded several enviable records. First television station in Africa, first real estate in Nigeria, first high-rise building in Nigeria, first modern sports stadium in Nigeria, first agricultural settlement in Nigeria, first modern civil service secretariat in Nigeria, and first industrial estate in Nigeria. His face is on 100 naira denomination as a mark of honor for his distinguished services to his country. Western Spring Television identifies Obafemi Awolowo as a major character in history. James Ajibolaige was a lawyer who obtained his first degree in classics from Nigeria's premier University of Ibadan. Born September 13, 1930, the orator and the polyglot spoke impeccable English, French, Igbo, Hausa, and Yoruba languages. His fine diction placed him among classical orators and public speakers like Cicero, the Roman orator. This attribute earned him the prefix Cicero of Esauke. He authored Kaduna Boy, an autobiography, Detainee's Diary, Constitution, and the People, among 6 other books. Bolaige was a colorful politician, elected governor of Oyo State in 1979 and appointed a federal minister in 1999. He was a pioneer founder of Afenifere, the Yoruba social, cultural, and political group. He invested his political sagacity to propel the group to the height of political leadership and decision-making in the southwest of Nigeria. Bolaige was assassinated on the 23rd December 2001. His murderers are yet to be apprehended till today. Western Spring Television identifies Bolaige as a watershed character in history. Fumilayo Ransom Kuti was an educationist and advocate of women's rights. She was recognized for her vitriolic comments against colonial policy of taxation as it affected the Nigerian women. Bere, as fondly addressed by her women followers, Fumilayo championed the initiation of universal adult suffrage, which gave an unprecedented leeway for women to contest elective offices and power to exercise voting rights. Married to a foremost educationist and teacher, Israel Oladotun Ransom Kuti, the first president of Nigeria Union of Teachers, Fumilayo Ransom Kuti was the mother of children who inherited her spirit of activism. Olufela and Be Ololari, the former, a renowned musical legend. She was the first female student of Abeokuta Grammar School and the first female to own and drive a car in Nigeria. The award recipient of Member of Order of Nigeria MON and Lenin Peace Prize, was born 25th October 1900 and was killed on 13th April 1978 by rampaging road soldiers in Lagos. Western Spring Television identifies Fumilayo Ransom Kuti as a watershed character in history.
Viewers, you're welcome back to Spring Clinic. And my guest is still very much in the house, a consultant ophthalmologist, Dr. BOLA OMOLOLA. Thanks for being on the program.
Thanks, sir.
Yes. Now, we are in an information age. Everywhere computers. In our homes, computers. We stare at our phones to chit-chat for all manner of social media engagement. How injurious is this exposure of our eyes onto these appliances?
Well, the said appliances, they have what we call beta radiations. Most of them are beta radiations that can damage the eye.
Did you say beta?
Yes, beta.
But the word beta is not a good word.
No. Beta, B is beta.
Okay.
Beta radiations.
Okay.
And ultraviolet radiations, white lights.
Okay.
All these ones can damage the retina.
Okay.
So most of the time when you are using, you are very much attached to your computer or things like that, it's better to use photochromic lenses, maybe plano, without any power, but at least to reflect all those lights, transcut, blue cut, and things like that can be used to reflect back all those injurious radiations.
Yeah. At the beginning, you stressed how dangerous alcohol can be to the eyes.
Yeah.
There are people that believe that emu, that is local palm wine,
Okay.
is an antidote to vision impairment. I don't know whether that is right. And we've been encouraged to consume as much as we can because it's going to preserve our eyes and our vision. Is this true? Is there any basis for it in science?
Well,
or just an illusion?
I think it's an illusion. Because people are encouraging some set of people to be taking a lot of palm wine. Palm wine contains some level of alcohol.
Okay.
And palm wine can be valuable to the body when it is taken fresh. That they took it from the palm today, you take it, maybe mix with water. The fresh one.
Yeah.
You know, when you take it from the palm tree and keep it maybe over 24 to 48 hours, you go there
to ferment.
It will ferment and it will turn to alcohol, and you'll be taking high level of alcohol.
So what we were told was that we have high level of yeast in palm wine, and
yes.
yeast is good for the eye.
Yes, the yeast is good for the eye, but it's not an absolute thing for the eye. So I wouldn't encourage anyone to take palm wine as volume. And okay, they said I can take palm wine, that the level of alcohol there is not like the brewed alcohol. Okay, let me take 5 liters every day.
That's a drunk.
Or even 2 liters.
Even 2 liters, okay.
Anything that we take, we do in excess, have negative impact.
Moderation. That's what you prescribe.
Yes, moderation.
Thank you very much. Now, again, regularly people tell us about the need for us to go for eye test. That as you do your general body check once in a year or once in 2 years, endeavor to submit your eyes for test or critical analysis by experts like you. Do you subscribe to that? Is it necessary?
Yes, it's very, very necessary. For patients, for individuals without family history of eye problems, can check your eye every 2 years. For patients with family history of eye problem, now you have tested your own you have visited an expert and they told you that, okay, maybe your father had glaucoma, your mother or any of your siblings that you are free. You should be checking every year as you ages from 40 years. But if there is any issue that you have, maybe you are a glaucoma suspect, you at least see your doctors every 6 months.
Every 6 months.
If you are a suspect. But if you have started medication or they have commenced any medical treatment on you because of a particular eye ailment, especially glaucoma, you see your specialist as they require. If they want to see you monthly, 2 monthly, 3 monthly, you ensure and endeavor to see them.
Okay. Now, people say at times that it's important for us to clean our eyeballs with eye drops. And they recommend all manner of salt that, okay, once in a while you can just drop it in there without going through the prescription stage or seeing an expert. You just walk up to the store, to the pharmacy store, you buy one of these eye drops and use it occasionally. How advisable is that? It's
not advisable, sir. It's not advisable at all. Because even in ophthalmology, as an ophthalmologist, if you have, for example, you have uveitis in your right eye, and I've tested the left eye and it's okay, and I give you a medication, I will tell you it's strictly for the right eye.
Okay.
So if I'm treating you as a specialist, I tell you that this medication is for right eye. So why will you now go ahead and apply?
For the left.
So if you are not having any eye problem, no itching, nothing, how will you just enter a supermarket or a pharmacy and obtain an eye drop and apply? Okay. No.
Now, again, teach us and take us through the ethics, the standard norms, and how to apply eye drops. Do we do it right? Just drop it in there. You drop it in there. How should we apply eye drop if it's prescribed for us to use it?
Okay. If a particular eye drop is prescribed, our prescription can give you to use twice daily. We can give you 3 times daily, 4 times daily, as the case may be. If you want to apply an eye drop, you pull down the lower lid. You raise up your eye and drop 1 drop. Because the drop...
What do you do? You raise up your eyes?
You raise up your head.
Your head?
Look up. You look up.
Yeah.
Then you part the lower lid and apply 1 drop.
Just 1 drop.
1 drop.
Not 2.
Not 2.
Per eye.
Per eye. And if you are using more than an eye drop, when you apply 1 drop, you close that eye for some time. You can wait for.
Okay. After you drop this,
yes,
you raise your head up.
Yes.
You drop it in there. Then you close it thereafter.
Close it thereafter.
For how long?
For like maybe a minute.
A minute.
But before you apply the second eye drop, for example, if you have 3 eye drops.
3?
Yes, we can prescribe 3 eye drops.
Wow, different kinds.
Different kinds.
Why?
For example, a patient with glaucoma may be on 3 eye drops, maybe on 2 eye drops.
Okay.
So it's not that you apply one, you immediately close it back and pick the second one and apply. No. Because the one you applied later.
There must be an interval.
Interval for it.
How long?
Maybe 3 to 5 minutes.
Per eye drop.
Per eye drop.
Per eyes.
Per eye before another eye.
Okay.
Another drop.
Okay. Okay. Now let's escalate this discussion to those who they have eye impairment, vision impairment, those who cannot see. In other climes, I was made to understand that there are ways that ophthalmologists give them vision one way or the other. Is that true?
Yes. Some patients with visual impairments, if, for example, a patient is having severe visual impairment, less than 360, is reading less than 360 or less, you can still improve the day-to-day activity of such patient with the use of telescope.
Okay.
You can give telescope to the patient. You can give handheld magnifiers. Walking stick is part of what we use to ensure that an individual with severe visual impairment can still live a normal life on their own, can still be independent.
And see
the independence of the patients.
Okay.
And there are other things like we have some computers that can be directed into the eye. You can use, with the use of, that will bring all what they want to use as large prints. For example, patients with macular degenerations and co.
Okay. I was privileged to host Professor Lighton, the CMD of Union Teaching Hospital, on this program. He's a plastic surgeon, as you may know.
Yes.
And we spoke about what we call skin grafting. That you can take something from somewhere, tissue, and introduce it here.
Yes.
Do you do that? I've heard that you can introduce other eyes back into the socket of another person and they will still have their vision back. Is that true? And do we do that in Africa?
We have not started doing that now.
Okay.
Actually, there's still advocacy on globe transplant, which is not yet in vogue.
Okay. In Africa, I'll be all over the world.
All over the world, it's still undergoing trials. But as per grafts, we do a lot of grafts in ophthalmology.
Okay.
For example, a patient with pterygium, if we remove it, some fleshy pterygium will eventually recur. So to prevent recurrence, we can take grafts. We take the graft from the conjunctiva in that same eye, from one part, and place it where we remove the pterygium. To prevent recurrence.
How, I won't use the word dangerous, or how meticulous must you be if you want to do eye surgery? Because I see it as a very delicate job.
Yes.
This very small thing, you bring it out and you want to do some surgery and manipulations on it. How do you do that? That must be very, 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 very delicate.
That was why our year of training to become an ophthalmologist is longer. Instead of us using,
because the eye is a very tiny thing.
Yes, but we use operating microscope that we enlarge the globe better than what you are looking at directly. So it will be bigger to be able to perform all your surgeries and do all those manipulations
that you want to do. Let's examine our standard of our ophthalmology facilities in this state. How equipped are we? Do we have the ability, the capacity to attend to eye challenges, the vision challenges, and the visual issues of our people? Well,
generally, ophthalmologists, we are not many. In Nigeria, we are not many. And in Osun State, in Oshogbo, we have like 4, 5, 2, we are like 7.
Attending to 4 million of us?
In Oshogbo. In Ife, we have like maybe 6 or 7 or 8 thereabouts.
That's about 10 in total.
So in total, we are like 15 going to 20 thereabouts in Osun State. Actually, there is high volume of patients. And for example, in Ashubiaro now, we have a standard center that we can take care of patients, but we need more personnel.
We have the wherewithal, the equipment. Do we do that? Do we have that?
We have. Okay. We have, because for example, the Lion Center, Lion Center is being co-sponsored by the state government and the Lion Eye Foundation. Okay.
Then I will go back to the issue of advocacy. But when I go about town and I see people being led by their kids, okay, fair, anyway, everywhere you go, and I wonder, how did they get to this level? If help had come, perhaps at the right time, they wouldn't be in this state. At that stage and that state, can you still intervene?
Yeah, yes. And I won't say absolutely yes. Because generally WHO bulletin, the one of August, states that we have 2.2 billion blind individuals in the world presently.
2.2 billion?
Billion.
Out of about 7.9 billion.
And 1 billion out of that 2.2, the eye problem that they have will have been preventable if there is wherewithal and if there is advocacy and
information.
If there is availability of information to the individuals that are having problem, that this your eye problem can still be treated. Some of the people that you see that they are just
being pulled around,
some of them have cataracts.
Okay.
Some of them, they are having eye refractive error that should have been treated far years ago. Some have a blinding pterygium that can still be treated.
Let's discuss cataract. How can I know that something like that is creeping in and I can take immediate action to prevent me from getting to a terrible state?
Well,
what are the signs and the symptoms that you will notice that cataract is building up?
Cataracts is, we call it opacification of the lens, while the layman we call it a blurry vision. Okay. From the beginning, you start, the patient, the individual will start having blurry vision, reduction in vision. What you are seeing clearly before is getting blur a little. By the time you can pick up cataract in an individual's eye, that this eye is white.
Okay.
The patient is not likely to be seen with that eye again. To be seen clearly, I won't say to see at all. If they can still see light, some of them will see cyan movement, some can still count fingers, but by then their vision is highly impaired. So when you start having blurring of vision, you should see your ophthalmologist. So we check the eye. Is this blurring of vision from the anterior segment of the eye, which may include the lens, or is affecting the posterior segment, which can affect the macula, which can also affect the optic nerve and the retina generally, which may also be due to diabetes. Part of what a patient with diabetes should do is regular eye check. Okay. Because diabetic patients are prone to development of cataracts early.
What are the preconditions that can predispose you to things like that?
To cataract.
To cataract.
Yes, that is part of what I just said. Exposure to excessive light. When you have a patient with glaucoma, can have cataract. If they are having raised intraocular pressure, uncontrolled raised intraocular pressure, can lead them to develop lenticular opacity earlier. Diabetic patients can develop lenticular opacity. High myopic patients can have cataract. So they are interwoven.
See on signs and symptoms and signs to watch out for. What are the signs that we should watch out for when you talk of glaucoma?
In glaucoma, it is, we call it a silent thief of the sight.
Silent thief?
Yes, silent thief.
Just like a thief in the night?
Yes, thief in the night.
Wow.
Sneak thief of the sight. Because by the time
just sneaks in.
It sneaks in. Because by the time the glaucoma is setting in, it does not affect the central vision.
Wow.
It affects the peripheral vision first. So by the time the patient knows that they are not seeing clearly, about 90% of the optic nerve fiber has been destroyed.
At that stage, will you notice anything, any strange development in your eyes?
No.
Before
So,
it stills
the only
eventually?
type of glaucoma that the individual may be able to notice is when the patient is having angle closure glaucoma that comes with pain, with raised intraocular pressure. We have redness, pain, headache, things like that will mimic even malaria. They can be vomiting. They can be having some symptoms that look like malaria.
Wow.
They are having angle closure glaucoma. But the most commonest type of glaucoma in this environment is a primary open angle glaucoma.
So what causes that?
That one does not give signs because the intraocular pressure is not too high. It's maybe high, but it's still within the normal limits that the individual will be able to bear. So the only thing that can make an individual with glaucoma know is if that person is very vigilant and you are noticing that you are not seeing your peripheral vision. That is until you move to a particular part, to one side, that is when you will see. You will be able to see. Maybe as I'm looking at you now, we have about 200-degree coverage of vision when you are looking straight. So by the time you cannot see from here, as I'm looking at you now, I'm seeing this TV. Though I may not be seeing the details clearly.
Yeah, but you know an object is there.
An object here, there is a wall here, green color. But in glaucoma patients...
I think I can see it too, so I'm good.
You are good. In glaucoma patients that is advancing, they won't be able to see until it forms a tubular vision.
So those are the signs?
Yes.
What is the cause?
There is no specific cause for glaucoma. You just have risk factors. Starting from age. Age is a risk factor for glaucoma. African descent, black race is a risk factor. Diabetes that we are talking about could be a risk factor. Eye myopia could be a risk factor. Smoking, alcoholism, use of steroids.
Those are the risk factors.
Those are the risk factors.
Yeah, because our time is fast spent and my directors are already communicating me that we need to round up. Light and sun. How much of it do we need to expose our eyes to? And how much should we not expose our eyes to?
When we are talking about light, for example, in the sun, we never advise an individual to just go outside during the sunny day. You just want to look directly at the ultraviolet light. We should, as much as possible, prevent direct rays of light from entering our eyes. Because it will destroy the photoreceptor cells.
And on the last note, is it advisable, is it professional, and will you cancel that we sleep with our light on, our light off?
Wow.
You want to sleep with the light, you leave with dim light or bright light?
In fact, we want you to put off your light when you want
Absolutely. In perfect total darkness.
Yes, so that the hormones that are supposed to be released, serotonin, like that are supposed to be released, that will lower the intraocular pressure overnight will be released. Because when you are putting on your lights, there will be break in the communication between the eye and the serotonin that should suppress, that will lower the intraocular pressure at night. So we advise, especially glaucoma patients that have family history of glaucoma, to put off their lights.
What of those who are not disposed to that?
People that are not disposed, it's better we put off our lights so that all the hormonal
as a strategy
release,
for prevention.
Yes, for prevention. All the hormonal release that is necessary to lower the intraocular pressure overnight will be able to come into play. Doc,
it's a pleasure to have you.
Thank you, sir.
Thank you very much.
Thank you very much, sir.
Viewers, our guest today at Spring Clinic that has been speaking to us about vision and eyes has been Dr. BOLA OMOLOLA, a consultant ophthalmologist who has taken us through the signs, the symptoms, and what we need to do to have perfect vision. Until next week, when your regular host will come on this program, I remain yours sincerely, FEMI ADEFILA, saying bye for now from Spring Clinic, Western Spring Television. Thank you.
Sports is a